The aim of this procedure is to identify transient myocardial ischemia among patients with suspected acute coronary syndrome, even when asymptomatic, using continuous 12-lead electrocardiographic or ECG monitoring. Patients with suspected non-STEMI or unstable angina are identified as they are admitted to the emergency department, telemetry department, or cardiac intensive care unit. A 12-lead ECG Holter monitor and a routine bedside ECG monitoring system are applied. Monitoring is maintained throughout a patient's entire hospitalization. The systems are regularly checked to ensure that the skin electrodes and lead wires have not been moved or misplaced. Finally, the stored ECG data is downloaded from the Holter's flashcard to a computer for offline analysis. Analysis of the data reveal the presence of transient myocardial ischemia as evidenced by ST-segment changes, either elevation or depression, during continuous 12-lead ECG monitoring.
Myocardial ischemia is often clinically silent, meaning common symptoms associated with acute coronary syndrome such as chest, arm, or jaw pain do not always occur. Since many current bedside ECG monitors assess fewer than 12 ECG leads, ischemia will be missed if it occurs in those not being monitored.
Today we will show you a method that can help identify transient myocardial ischemia in both patients who may be asymptomatic and in those who may not be responding to anti-ischemic therapies. This method can also be applied to the detection of arrhythmias and lengthening of QT intervals.